Hi, my name's Casey, and tonight we are learning about radiation therapy. Radiation therapy is one of the treatment options with cancer. Radiation causes cell death through breaking chemical bonds of DNA. Damage may either be lethal or sublethal. Sublethal damage may be repairable. Cancer cells more likely to be permanently damaged by cumulative doses of radiation because they are less capable of repairing sublethal DNA damage than healthy cells. Tissues that have high proliferative rates, such as bone marrow, skin, and GI tract, are most effective. Radiation dose. Oh my gosh! Radiation dose is determined based on tumor volume, type of tumor, and treatment setting. Simulation is a part of radiation treatment planning. It is used to determine the optimal treatment method by focusing on the geometric aspects of treatment, as in where exactly to point the radiation beams. Target is defined by using a variety of imaging techniques, physical examination, and surgical reports. Once target is verified, marks are placed on the skin to mark the treatment ports. These small tattoos ensure the patient positioning is precisely reproduced on a daily basis. Treatment usually daily for radiation, Monday through Friday, for 2 to 8 weeks, dependent on cancer type. And this is different from what we've talked about before with chemotherapy, where it was one session IV, and then the body needs time to reach its peak and then rest because of bone marrow suppression. There are two different types of radiation therapy. There are external and internal. External therapy utilizes mega voltage machines, such as linear accelerator, which produce gamma and electron radiation. Treatment ranges from 1 to several minutes. It can be given preoperative to decrease tumor size, increase potential for removal of entire tumor. Can be given post-op as well, but need to delay until wound healing is complete. Can also be used for palliative to prevent or relieve clinical manifestations caused by cancer. With internal radiotherapy, placement of radioactive source directly inside the body, either into tumor or close proximity adjacent to the tumor. It may be sealed within a container placed in the OR, radiation department, or treatment room. Exact positioning is essential. X-ray films taken to verify appropriate placement. Patient returned to private hospital room where the radioactive substance is inserted. Left in place for a few hours to several days. That is a low dose rate. Or can also be inserted by positioning the applicator in the tumor cavity. The radiation source is loaded into the applicator in the form of pellets or tubes, typically only loaded for a few minutes. This is known as a high dose rate. May be repeated weekly or for several weeks. This is usually an outpatient option. This requires protection of healthcare professionals from radiation. Exposure should be as low as reasonably possible. Exposure should be controlled by time, distance, and shielding. Minimize time and maximize distance. There should be no pregnant caregivers when dealing with radiation. Permanent implants can be inserted directly into the tumor tissue, where they remain permanently. These can emit low energies with limited tissue penetration, so the patient is not radioactive. Radiotherapy can also be administered via unsealed internal form, such as isotope iodine 121, to treat thyroid cancer. This is a radiopharmaceutical therapy form, and it can be excreted through bodily fluids, so cautions need to be taken. So those are some basics about radiation and radiation therapy. In the next video, I will be discussing the problems that are caused by chemotherapy and radiation therapy.